I wonder too, I know Dr. McGinn, we were talking about this personally earlier, about some of the kids and the reports that we've been getting of them just acting out and maybe not making age appropriate decisions. And I had heard from a teacher who said they're seeing fistfights in school, kids yelling at teachers, and one of the things that she said that rang out to me was these kids don't know how to be in a room with other kids. They're having difficulty relating to one another.
Yeah, I mean, this prolonged isolation has been really hard for kids. So you certainly realize how much school is a place for socialization, for learning how to behave. So the kids have not only been stuck at home, they're working with caregivers who are also impacted by the pandemic. So their own parents are busy trying to navigate work at home, so they're not able to manage as well as they might otherwise. So we're definitely seeing that in so many schools.
Jeffrey wants to join the conversation, saying in the aftermath of September 11th, federally sponsored Project Liberty provided trauma training to thousands of psychologists, psychiatrists, and social workers. A similar effort must be launched now that would also provide caring for the caregiver support groups for overworked and sometimes overwhelmed mental health task force. Sherry.
Absolutely. I certainly can speak for myself and my colleagues, and I'm sure that Dr. McGinn would agree. The amount of referrals that we're seeing, it's just extraordinary right now. And so not being able to help everyone that you want to while still being able to help those that you need to and your family is overwhelming. I think a lot of caregivers are kind of joining forces and offering support to each other. But yes, I would agree that if there were some additional supports, that would be vital. It is something that we need to recognize that we're going into our next pandemic, which is our mental health pandemic.